My music is really important to me. It's a big part of my life. I sing at weddings, I sing at funerals. I'm a cantor at my church, which means I'm a soloist, and I lead masses by myself. And I sing with my choir for soprano. And I was having some breathing problems. My breath control was getting not as good as I would have liked it to be. About 10.5 years ago, I was given the opportunity to open a business that involved medicine, and I jumped at it. And Passport Health is a travel medicine business. We get people prepared to travel internationally. We started with one office. We've expanded to 5 in the Houston area and are still going and enjoying great success. Well, I'm an insulin-dependent diabetic, and I was visiting my endocrinologist for my normal office visit to get my new prescriptions. And he asked me specifically if I'd been having any chest pain. And I had been experiencing some mild discomfort in my chest for about 6 to 8 months, but had kept quiet about it. And when he asked me point blank the question, I decided I better fess up. Told him yes. And that afternoon I was in the cardiologist's office, and just a day or two after that, having all the tests. I had a negative stress test, a negative EKG, but we went ahead and did the arteriogram, and that's when they found the blockage.
She was found by her cardiologist to have a blockage in the artery that runs in the anterior surface of the heart, which is, in layman's terms, they call the widowmaker. And she was found to have a blockage there that was not amenable to a cardiologist doing an angioplasty and a stent, and she needed bypass surgery. And thus she was referred to me to have her bypass surgery performed robotically.
The robotic surgery was huge for me because, number one, they don't have to open your sternum, your breastbone, and you don't have to go on the heart-lung machine. So when I heard that I was a candidate for the robotic surgery, I was extremely excited because nobody wants to have surgery, but if you do have to have it, the fact that it was going to be minimally invasive was just huge for me.
Ms. Medellin's case went beautifully. She was an excellent patient. She did everything that the doctors and the nurses asked her to do. We were able to do her robotic bypass to the widowmaker lesion, and she was in the hospital in the intensive care unit for 1 or 2 days, and then was on the floor for 1 or 2 days and was able to go home. And she's a small business owner, and it's a small company, so it was very important for her to be able to get back to work as soon as possible. And within a couple of weeks, she was already back to her job and taking care of her business.
After my surgery, it just, all of a sudden, my breath control was just so much better. I just had so much more lung capacity because I actually had blood flowing to my lungs that I hadn't had for a while. Everybody's commenting on my breath control now. I can hold a note forever. My experience here was wonderful. They have all the most up-to-date equipment, and everything was just as it should be. I didn't have to travel to the medical center. I live close by, so I was able to just be close to my home and at the same time have all the benefits that I could have at any hospital anywhere. It really hit home that if I hadn't finally opened up and admitted to my doctor I was having chest pain, I was at the point where if I had gone on very much longer, I would have had a total blockage and I probably would have died. So I'm just really happy to be alive and to continue on with my business and expand it and grow it, enjoy my family, and hopefully have a lot more years of life ahead of me.